Can coffee protect you from liver diseases including fatty liver? The extent of any beneficial effect is still being investigated. Coffee has long been recognized as having liver protective properties. Coffee appears to reduce risk of liver carcinoma, reduce the advancement of fibrotic disease and a variety of chronic liver diseases, and perhaps reduce ability of the hepatitis C virus to replicate. A recent 2015 meta-analysis of 16 case control and cohort studies of Western populations demonstrated a significantly reduced incidence of cirrhosis amongst coffee drinkers. Over 30 million Americans have chronic liver disease and about 31,000 deaths have been attributed to it yearly. Studies evaluating coffee's potential protective effect on liver disease are important as they may represent a simple lifestyle modification patients can incorporate to enhance their health. Coffee and an association with decreased liver enzymes. In numerous studies, it has been noted that coffee consumption has been associated with decreased levels of aspartate aminotransferase called AST, alanine aminotransferase called ALT, gamma-glutamyltransferase called GGT, and alkaline phosphatase named ALP. One of the first studies to document consumption of coffee with relatively decreased GGT was in 1985 in the Tromsø heart study. That same year, another study noted an inverse relationship between coffee consumption and AST and ALT levels amongst both Korean and Japanese immigrants. These studies began an investigation into elucidating a more direct relationship between coffee and possible hepatoprotective properties. The Tromsø study looked at multiple beverages, notably including green tea. Since 1985, multiple other studies have been performed with similar findings when testing specifically for the possible effect of coffee consumption on liver disease. While studies had been performed previously testing for coffee consumption and its association with liver enzyme levels, one study evaluated effect of coffee in patients with risk factors for chronic liver disease, consumption of greater than 2 alcoholic beverages daily, positive serum HBV antigen, positive serum HCV antibody, transferrin saturation greater than 50%, elevated BMI, and uncontrolled diabetics. This study demonstrated relatively reduced levels of ALT amongst these higher risk groups. Coffee and likely protective effects against development of fibrosis. Given the above information, the association between coffee and relative reduction of liver enzymes appears clear. However, the benefits of coffee appear to extend further. In a 2015 population-based prospective cohort study demonstrated coffee intake with reduced mortality from chronic liver disease. In fact, as little as 1 cup of coffee consumed daily resulted in 15% reduction in risk of death from chronic liver disease. 4 cups daily was associated with 71% reduction, suggesting a dose-dependent response. This study appears to reaffirm the findings of an earlier 2005 study noting that consumers of coffee and tea exhibited a significantly decreased risk of chronic liver diseases. The study followed 9,849 participants for a median of 19 years and a decreased risk of hospitalization or death with chronic liver disease. A dose-dependent response was seen again in this group, with consumption of 2 or more cups of coffee doubling the relatively reduced risk of complications than those drinking 1 cup. A 2003 Norwegian study found similar findings, noting progressively improved mortality with increasing coffee consumption, though the effect appears to negligible beyond drinking 4 cups of coffee daily. In addition to less frequent complications of liver disease, there is evidence demonstrating coffee has an association with reduced fibrosis. A 2010 study evaluated effective coffee intake over a 6-month period in a group of 177 patients with variable degrees of liver fibrosis. In this study, intake of at least 2 cups of coffee daily was associated with a less advanced observed fibrotic disease. A 2011 study echoes these findings, noting that advanced fibrosis in a population of chronic HCV patients was not only seen significantly less frequently in coffee drinkers but that the frequency decreased with increasing reported coffee intake, again suggesting a dose-dependent response. A 2014 Brazilian study reinforces this impression, evaluating 136 patients with biopsy, ultrasound, or endoscopic evidence of fibrotic disease, finding that individuals drinking higher amounts of coffee demonstrated a significantly lower frequency of advanced fibrosis on liver biopsy. A 2015 study of 910 chronic HCV male patients evaluated the association of daily intake of various caffeinated beverages, including coffee, finding a higher percentage of coffee drinking amongst patients without advanced fibrosis than those with demonstrated fibrotic disease. A recent meta-analysis of multiple cohort studies and case control studies independently demonstrated a significantly reduced risk of cirrhosis with consumption of at least 2 cups of coffee daily. Coffee clearly correlates with reduced frequency of fibrosis, but is coffee itself responsible for these effects, or can its probable protection against fibrosis be seen utilizing any caffeinated beverage? Other studies referenced above seem to suggest hepatoprotection is unique to coffee amongst caffeinated beverages. However, a 2001 study attempted to answer this question head-on. This group noted that caffeine intake from other beverages did not show significant odds ratio, along with no evidence of significant trends over the amount of intake, whereas with coffee intake there was an inverse association with cirrhosis and coffee consumption with just 1 cup of coffee daily. A 2012 study found a similar association of reduced observation of advanced in coffee drinkers but not in espresso. In a study involving inpatient cirrhotics, it was noted that caffeine intake from beverages other than coffee did not show significant odds ratio, at least in relation to liver cirrhosis. Multiple studies referenced above demonstrate beneficial effects related to coffee that are generally not reproducible when testing against other caffeinated beverages. Regardless, as a biologic mechanism has not been proposed, the link is still unclear. Development and progression of fibrosis appear to involve multiple factors at play in the disease process. Metabolic syndrome appears to be linked to increased risk of fibrosis, though the relationship has not been fully described at this juncture. Research involving coffee and liver disease appears to demonstrate a close relationship between these disease states. In a mortality follow-up study of 51,036 individuals, it was noted that coffee drinking had an inverse association with cirrhosis risk in the setting of 4 or more cups of coffee consumed daily. See the description and comments for references. We would appreciate your comments in any language. Think, your health is very important for your family as well. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video. End of video.